subject I would love to tackle is painful what that means for women and what that means for relationships.
If you're in perimenopause, some of the things that you may start noticing are dryness during intercourse. You may have to feel like you are using lubricant, or there's just dryness or itchiness, a feeling of pressure or heaviness in the vagina.
Dr. Sara Reardon. Dr. Sara Reardon. Dr. Sara Reardon, also known as the Vagina Whisperer. The power of social media to educate women about their health. She's out with her first book, Floored, a woman's guide to pelvic floor health at every age and stage.
Board-certified pelvic floor physical therapist. She's the founder and the chief vagina officer of the Vagina Whisperer, an online pelvic floor workout program for women of every age and stage.
What would be an ideal postpartum care situation?
You know, I think there's always like levels of like, I'll take this, but the dream would be this.
What is wrong with society that women have children and then we're like, good luck? Why is it that we have to sort of wait till there's a problem before we react?
That is the way that our medical system works, and it's really unfortunate and ineffective.
This episode is sponsored by Laird Superfood.
One of the things I'm on a mission to do is to get adults to eat breakfast again.
Yeah, and one of the reasons that we're really excited about people eating breakfast is we need to eat enough, and in most cases, more protein. And if you skip an entire meal,
You're behind.
you're behind already. Like by the time you get to lunch, you can't catch up.
Could not agree more. The other thing that we're seeing is that sometimes people just aren't breakfast people. I have a daughter who's not a breakfast person. I'm sitting next to not a breakfast person.
I am not a breakfast person.
And you have trained yourself to get some micronutrients and some macronutrients, specifically protein in the morning. And I really appreciate that about you.
Yeah, but one of the ways
Girl
that
can
I
learn.
get a few calories on board, as well as 12 grams of protein, is with Laird Superfood Protein Creamer.
What's great about this is that it's the classic mushroom blends, like all these super functional mushrooms, plus all of the micronutrients and great healthy fats from the creamer. Then they've added a little protein.
And what's nice about it is, and I think you know this, is a lot of proteins don't mix well in
No,
other things.
at all.
But this is not the case.
Gross.
This makes a super smooth and creamy, yummy, tasty cup of coffee with protein. It is a vegan, plant-based protein. And it's so tasty.
Yeah, it's equivalent of 2 eggs.
Yeah.
And so what I think is like, you're like, hey, I'm in a hurry. I'm going to have this nutrient dense coffee and I begin to have my bases covered. And I think that's how I really like to think about it.
Yeah, I mean, before I train, I leave the house with, a little bit of coffee, which keeps me alive, some general calories,
my pre-workout is
some
always coffee.
adaptogens, and some protein on board.
Yeah, you can't beat it. And I think if you're traveling, you and I travel, we always seek out the coffee. Now we have because we often don't eat breakfast when we travel. We just kind of go on to the day. We just hope. So this is an easy way to meet your needs. A nutrient dense cup. All we're doing is adding in enough protein to just maintain your muscle mass. I think this is a great solution for those of you who don't like breakfast.
Which I'm one of those people.
Yeah, yes, you are. To learn more, go to lairdsuperfood.com/TRS and use code TRS20 for 20% off and free shipping.
This segment is powered by our friends at The World As You'll Know It. Their latest season, The Future of Aging, dives straight into the holy grail of medicine, slowing or even reversing aging.
They bring in leading voices from biology, neuroscience, and medicine to ask whether we can reprogram cells, reboot immune systems, and extend health span, not just lifespan.
Imagine 20 extra years of trail runs, back squats, and grandkid piggybacks because researchers cracked the code on cellular damage. Sounds sci-fi, but these guests are running the experiments right now.
Episodes unpack everything from molecular tweaks to brain plasticity drills, plus a sober look at which miracle supplements don't deliver.
For anyone chasing longevity through smart training, like our Ready State tribe, this podcast is essential listening.
Search The World As You'll Know It, The Future of Aging. Hit follow and stay ahead of the curve.
Let's get into today's show. Dr. Reardon, welcome to the Ready State podcast.
Thanks so much for having me.
So we are here today to talk about your amazing new book called Floored, all about, it's a women's guide to pelvic floor health at every age. And I'm just going to kick it off because I loved the subtitle of the introduction, and that is the current state of down there care. So, what is the current state of down there care?
So unfortunately, it is in a poor state because I feel like we're not really talking about a lot of the pelvic floor issues that women are experiencing. And just to clarify, all genders can experience pelvic floor issues. All genders have a pelvic floor. I focus this book solely on women's health and pelvic health issues because that's where I have the majority of my experience in my 18 years of practicing. And also because women are more vulnerable to pelvic floor issues because they go through experiences like pregnancy and postpartum and menopause. But, more women experience urinary leakage than osteoporosis, high blood pressure, and diabetes, yet they're less likely to get treatment for pelvic floor issues. And I think we really need to start having these conversations so that women and medical providers are aware that this type of care, pelvic floor therapy, is available and very successful in treating these issues so that women aren't suffering silently.
We're in this really amazing time where bright physios, bright instructors are moving what was traditionally held in offices behind walls. You're saying, we describe it as there's a lot of very highly skilled work, but then there's a lot of information and a lot of practice that we're going to call unskilled. And when I mean unskilled, I don't mean that it's not technical, that it's not sophisticated, but that it can be done by a person. And one of the things that I love about this book and I love about your approach is that it's so much organized and centric around shifting loci of control back to the person. It's not saying, here's a book about clinical diagnosis, here are the questions you need to ask your practitioners, but here's what you can do to have some agency and to change your own experience around this sort of very hidden process that frankly, no one talks about and is all too prevalent.
Right. And that's an amazing way to say it. And I'm like, come on tour with me because that's a perfect song. But, I think one of this is a silent epidemic. The statistics are very clear. 1 in 3 women will experience a pelvic floor issue at some point in her lifetime. 50% of women over the age of 65 leak urine. We spend billions of dollars on pelvic floor dysfunction, and we're often treating the symptoms instead of getting to the root cause of the problem. And I think as physical therapists, we're really trained to kind of look to always take a step back. We're not just slapping on cold packs and hot packs and medications. We're like, what led to this dysfunction? And I think that in the realm of pelvic health, when you're not incorporating a pelvic floor physical therapist or occupational therapist, we're missing the lens of what's causing this. So women are continuing to have these problems. They're affecting their quality of life, their work life, their ability to mother, to have intimate relationships, to exercise. And we've kind of been told to just deal with them. Like, oh, you have a vagina, you've had babies, you're getting older as a
Oh,
woman.
no. Here's another undergarment that you can wear. Here is
Right.
special exercise
Yeah.
clothing, right? I mean, it's
Now we make underwear with pads in them. Like, how about that? Like, look at all the innovation we're doing for you. And it's really like, really? This is the only option that we have when it's actually not the only option.
So, you have this phrase you use called common but not normal to talk about pelvic floor issues. And so I'm wondering if you can sort of, and I'm sure people listening to this, many of my friends have experienced a lot of these issues, but like, what would you say are the top common but not normal pelvic floor health issues you see?
I want to jump in just because Juliet's married to a physio. And for 100,000 years, I've been like, that's not normal. She's like, I'm normal. It's just not typical. And so I really appreciate this language, common but not normal, because it is important to say, hey, what should we expect out of our bodies? What is baseline function? And I think it's important to define that.
Yeah, and at different stages of our life,
Correct.
right? Because we have a pelvic floor throughout our whole life and probably a different experience. But like, exactly, at what point do we know we have a problem versus, there's got to be some normal changes to our pelvic floor. So talk us through this whole common but not normal idea.
And I think one of the challenges with people not even knowing the difference between common and normal is that we don't even talk about this part of our body. Most women don't even know it exists. Young women don't know it exists. So when there's a problem with it, they can't attribute it to like, oh, that's a pelvic floor problem. Is it common or normal? They're like, we don't even know it's there. And so I think a lot of it goes back to just the lack of awareness we're taught about the pelvic floor from a very young age. And that's really why I start the book like with menstruation. And particularly for people who have, daughters or young children, it's that if we can start talking about what's normal when we're young, with the normal way to pee, the normal way to poop, what's normal for periods, pain is not normal. Being able to insert menstrual products comfortably is normal. Pain free gynecological exams, normal. But when we don't even know what's normal and what's not, we can't even, kind of start to discriminate. Well, oh, is this a problem? And then where do I go seek help? And then as we start getting sexually active, when we maybe go through pregnancy or childbirth, a lot of the common but not normal symptoms start to arise, like urinary leakage or discomfort with intercourse or cesarean scar pain or prolapse or even what we call like a mummy tummy, like weak abs for due to a diastasis recti. And a lot of this is like, oh, you've had babies or you're getting older. This is normal, but again, it's not normal. Normal means that we can function without pathology or symptoms or disease, but we're kind of just taught as women to deal with them and figure out how to, work around the dysfunction versus actually treat it. And so a lot of this, I think, is to a lack of awareness and education. And then also, once we do have the courage to discuss a pelvic floor issue, say with a medical provider, it's kind of dismissed as, oh, that's normal, when in fact it's not.
Yeah, in the pre-roll, I just talked about how I'm seeing a little bit of a shift in my daughter's conversations about their body functions and how comfortable they are discussing their periods and just that they're like, yeah, this is like a man, or this is just human beings being human beings. And they've really begun to normalize that. Oftentimes because we owned a gym for so long, initiated a lot, and we had a pelvic floor therapist on staff for a long time. And we initiated a lot of conversations around, we'll call it pelvic floor dysfunction, when it was related to performance. And we found that that was an easy way in for a lot of people to initiate a conversation, because we said, hey, we noticed that you're peeing and you're snatching or double undering, and hey, what's going on there? How long that's been going on? And just being curious about that. We did keep a towel on the platforms because it was so common to just wipe up the pee during a session. And eventually, we'd say, hey, we have solutions and we'd love to talk to you about this. And then people were like, wah, 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 I'm not ready. But then it was
Well, it's also embarrassing.
It was embarrassing. And it was a way in finally for people to begin to say, hey, and then also then there were so many follow-along conversations about this. So, you really bring up this point that as practitioners, as coaches, and especially as someone who works with 50% of the population, this needs to be on your radar.
Yeah, it needs to be on your radar and it needs to be not normalized. I
That's
think
right.
the conversations need to be normalized, like ask about them, encourage support, recommend therapy, but not the problem. You can't normalize the problem because although you feel like, oh, well, this woman knows she's peeing her pants, again, it's embarrassing. But what you're leading to is perpetual dysfunction that will only get worse. Like these symptoms don't get better. If anything, they get worse. You're continuing to kind of push your body past what your tissues can tolerate, they can support, what your pelvic floor can handle. And again, as your hormones change, as you go through pregnancy and postpartum, like that only gets worse if it goes untreated. And so I kind of unfortunately feel like it's a little bit of a disservice when we kind of, shrug off these issues as quote unquote normal because no offense, but I'm like, if a man was walking around doing this, like, would we just be like, oh, it's totally fine. He's just peeing his pants. Like,
That's a
just put a liner
solid
in.
no. That is a solid no.
Yeah, just
That
wear
is
a
a solid
pad.
no.
Just wipe it up with a towel. It's no big deal. And I think that we would put more research dollars behind figuring this out and getting treatment. And ultimately what you want from an athlete or what you're trying to optimize is performance. But many, many women leave the sport or leave exercise because of pelvic floor problems. So it's something that I think that we want to be attuned to and really kind of encourage early diagnosis, treatment, proactive and preventative tips to help manage them and stay in their sport.
So I'd love to talk a lot. I have 1,000 questions about the specifics here at all ages. But I would love to go back a little bit because, you have grown a big following on social media. And you are known as the Vagina Whisperer, which is like the greatest title of all time. And if I'm not mistaken, and if you could tell this story, I think you started by wearing a vulva costume. And that was sort of the beginning of you. I know you've been practicing pelvic floor therapy, but you, I think, realized that, you could have a certain amount of impact in your own clinic, but that you could amplify that impact on social media. So tell us a little bit about that backstory and, what you've really learned by putting out this content publicly.
Sure. And I think, when we start down these paths, there's no goal of like, I'm going to build this platform and get this many followers. It's really that we're so passionate about what we do. And we feel like everyone we needs to know the benefit of that type of therapy. And for me, that was pelvic floor health. As I mentioned, I've been practicing as a pelvic floor therapist for 18 years. It's all I've done. Before this, you and I, we were all chatting about orthopedic stuff. I was like, that's, not my jam. It's been a minute. But I've only done this type of therapy. And I am really passionate about helping people, and particularly women, better understand their bodies and to help them get relief from, again, symptoms they thought were common, but they're not normal. After I had been practicing for about 10 years, I had went through my first pregnancy. I did a lot of childbirth preparation in pelvic floor therapy, and I had a really incredible birth and a really great postpartum recovery physically. The rest of it was kind of bananas, but physically, I was like, "Oh my gosh, this is possible." I've been helping women for a decade thinking that we were just all doomed to have pelvic floor problems when that wasn't the case for me, and I felt like, again, everyone needs to know this information. Why is it just the people who were seeing me in Dallas, where I was working at the time, or who had the opportunity to get referred to therapy were privy to this? So I started an Instagram account for my girlfriends, my friends at the time who were also getting pregnant and giving birth. And I was giving them tips and tools about perineal massage and the best belly braces for pregnancy and how to modify planks. And then it was just organic growth from there. And this was back in 2016 or 2017, where Instagram wasn't this huge educational platform. It was literally just photos we could snap. I think my first photo on there was like of a bunch of lube, it wasn't anything like earth shattering. But the growth of my account really is a testament to how much women and medical professionals want this information about pelvic floor care, but they're not getting it from, health education, from medical providers. And then the vulva costume popped up when I reached 10,000 followers, I think after having the account for a year. And that used to be like a big deal because you could finally like share a link in your stories. And I still wear that vulva costume like very regularly on the account. So it's really been an incredible journey. As a PT, I don't think I ever imagined myself being here, but to see the awareness of pelvic health grow and help so many people is just amazing. And I'm just really grateful that I'm doing this work and love what I do so much.
Let me take a step back for everyone. I think probably everyone here knows a woman. Everyone has maybe you even have girl children or a mother, as chances are. But define pelvic floor for us. Like when is it like, we've seen a revolution come and go around talking about diaphragm and breathing and biomechanics. And I'm like, oh, that's cool. That's 50% of your, container. But define pelvic floor for us and sort of demystify it. Because when the layperson says rotator cuff, I'm like, what does that mean to you? And they're like, well, it's just some stuff in my shoulder that rotates the cuff. And so when you hear pelvic floor, you're like, it's a floor in my pelvis. What do you mean? Because I have my own working definition because I talk about this ad nauseum and I'll hopefully share some funny stories of working with men just so that this can be a wonderful way to talk about, pelvic floor health with all genders. But when we're talking pelvic floor, what do you mean? Give us some anatomy. Help us understand what's inbounds and out of bounds.
So your definition is not off. It is the floor of your pelvis, and it's 50% of the container because the diaphragm's at the top and your pelvic floor muscles are at the bottom. But if you imagine those ring of bones, the bony pelvis, it has an opening at the top and an opening at the bottom. So at the very bottom of that opening, you have a basket of muscles that sits like a hammock, and it attaches to the pubic bone in the front, the tailbone in the back, and kind of slings side to side to the ischial tuberosities, your sit bones. And that basket of muscles, again, it's in all genders, supports your pelvic organs. So in the female body, your uterus, your ovaries, your bladder, which holds urine, your bowels, which hold stool, all rest inside of that hammock. In male bodies, it's the prostate, the bladder, and the bowels. These muscles also have openings. So in a female body, it has three openings: one where the urine exits, one for the anal opening where poop exits, and then the vaginal opening for vaginal birth, menstruation, and vaginal intercourse. And the male body has two openings: one for the urethra for urine, one for the anal opening. The reason that women are more susceptible to pelvic floor issues, although all genders, again, and particularly males can have issues as well, is because we have that third opening. That it's what we call the urogenital diaphragm. That opening in the muscles is like an area of weakness, an area like a path of least resistance. So there's more pressure. We go through monthly menstrual cycles that where our hormones change and it affects those muscles. We go through pregnancy and birth where those muscles get stretched out. Often they can even have a tear. And then during menopause, the hormones in our bodies, the lower estrogen, testosterone levels kind of weaken and thin those muscles. So women are more susceptible to issues. But again, these muscles are working all throughout the day. They're holding in urine and stool. They're relaxing for, bathroom trips. They have to relax for menstruation and intercourse. They're supporting our core and they co-contract with your transverse abdominal muscle. So they're super important. Yet again, most people don't even know that we have them, even physios. So it's pretty wild that we kind of jump from like the ribs to the knees and we don't think about the pelvic floor muscles and their function and when we address body.
So I'd love to hit a few of the things that I hear about a lot from my friends in my own life, working with people. And we've touched on it a little bit, but the sort of peeing yourself leakage issue has been a big one. Obviously, we owned a gym, as Kelly mentioned. I'm a mom. Most of my friends are moms. This is an ongoing conversation. So I'm assuming your point of view is this is common, but not normal. And what are some things that women who are suffering from this can do on their own? And then how should they know when they actually need to go to a practitioner to get help?
And are
with
you
this?
asking about bladder incontinence, or are you talking about any pelvic floor pain, sexual pain?
I'm talking about like actual like bladder issues,
Okay,
like
take that one.
leakage, like, you're jumping rope, you sneeze. That's the most common thing that I hear about and know about amongst my peers and people that we work with.
So I would agree with you. I would think urinary incontinence, as you mentioned, Kelly, is probably the most common type of pelvic floor issue that people experience. And again, they don't even realize that their pelvic floor muscles are a contributing factor or maybe the factor that are causing that leakage. And when that happens, it's that your bladder has some urine in it. Your bladder's never completely empty. It always has a little bit of residual volume. And anytime you cough, sneeze, or jump, there's pressure down on that bladder. And when your muscles can't close that sphincter well enough to hold the urine in, you get a leak. It can often happen with the urgency to urinate or kind of a full bladder walking to the bathroom as well, which is called urgent continence. So there's two things you need to do is one, you need to learn the proper way to pee and poop. And I say this because we're never taught it, right? Like, so even as young kids, this is one, like when you're potty training your kids or, teach them the proper way to go. For females, I would encourage you to sit down so that you're not hovering over a toilet. So your standard should be sitting down. If it's like a super gross toilet, that's fine to hover or squat over it. The second is when you sit down, lean forward to kind of put you in more of a squatting position, which relaxes your pelvic floor the best. And last is to not push when you pee. And I call this power peeing. I think as women and moms, we're always like wanting to be so efficient and move on to the next task. But when you pee, you need to chill because your bladder is a muscle that pushes the urine out for you. So just sit, chill, and breathe. And the reason that's important is because you could be weakening your pelvic floor muscles every time you pee if you're straining or pushing. And you pee 6 to 8 times your day, and you're weakening your muscles every time. So I'm like, you could do Kegels till the cows come home, but if you're not changing some of those things in your daily habits, it's not going to help you. Oftentimes with leakage, you can have weakness where you'd want to do some strengthening exercises of the pelvic floor, but many women also have tension. And you need to relax the pelvic floor tension first with breathing and yoga and postural changes before you strengthen. So it's really important to discriminate which pathway you need to walk down to treat the incontinence. And then also look at things you might be drinking that irritate it, like coffee or wine or bubbly waters. Those can also be bladder irritants. So some lifestyle changes, some exercise stuff, but again, these are really just like if somebody came to you with rotator cuff issues, you would not just like, oh, just go do like a bunch of bicep curls or rows, right? You would look at how they're moving, change their posture, change their mechanics. You would kind of look at all of those things and if they have tight muscles, release that first and then maybe go into strengthening. The same thing applies to the pelvic floor.
Can I ask a quick question?
Oh, yeah, go ahead.
So after I had my own kids, I definitely had some like very light leakage issues, which resolved themselves. And one of my theories on it, because I didn't do anything specific other than continuing to do a serious strength and conditioning program. And so my assumption was that I was just by doing a generalized strength and conditioning program, that was why I, that problem resolved for me without seeking any kind of professional help. Is that true? I mean, is that possibly true? Obviously, you can't diagnose my specific situation, but for like, let's say women who are postpartum and at a safe point where they can exercise, obviously, is strength training something that can help resolve these issues?
If you rebuild the pelvic floor and core strength first, like before at 6 weeks postpartum, your pelvic floor is functioning at 50% of the strength and endurance it was pre-pregnancy.
You say that like
So
it's a bad thing. We got to get back into the deadlifts. Let's go.
Right, exactly. But I'm saying that's when we get the clearance to go back to the gym, right? So
Right.
if you're trying to resume your normal strengthening and like your deadlifts or whatever it is that you're doing at your previous weight, you're loading your pelvic floor before you've rebuilt that strength and endurance. And every time you load your body, load your spine, that's pressure on the pelvic floor. So I really encourage doing some really focused, deep core and pelvic floor strengthening. And for you, it was likely that you know this, the mechanics of engage the transverse abdominals, kind of exhale with exertion. You know those mechanics, but most people don't. And so I think that you can absolutely build strength by doing those things if you've got the right mechanics while you're doing it. I think a lot of trainers and instructors don't know how to do that properly and aren't really focused on that kind of postpartum rehabilitation state to rebuild their cores and pelvic floors before increasing a lot of load or intensity. And that's a key point. So, I will say that I'm 42 years old, I'm perimenopausal. And I started playing tennis at the age of 40. So at 40, I was like, I'm going to pick up a new sport. Okay. So
You're here.
yeah. So I'm like, and it's incredible. I love it. But about a year ago, I was playing tennis and I made a quick sidestep and I was like, oh my gosh, I think I just peed. And I was like, I'm the vagina whisperer. I can't pee my pants. Right. So I'm like, and the whole game, rest of the match, I was worried, are my pink leggings wet? Can you see it? I mean, I lost the match. Your mind doesn't go off of it. It is so consuming and embarrassing. And I said, I'm perimenopausal. My hormones are changing. I'm doing a new activity in sport. I have to train my pelvic floor just like I would train my rotator cuff for tennis. Like you have to train these muscles just like you would anything else to perform and function. And I started doing pelvic floor strengthening, but working it into my strength training routines.
And
it's better.
Is this kind of pelvic floor strengthening people can do on their own? Do they need to do it with a qualified coach or a pelvic floor therapist? I imagine you talk about this in the book. But yeah, what can people do on their own versus what do they need? And also, is there a level of severity? Like, is there a level of severity where you're like, okay, skip all this at home stuff and go, do not stop, do not pass go directly to a therapist?
Let me jump in as a man here.
Oh, okay.
That was for you, Lisa.
Lisa just died.
And what I want us to say is it's okay to get help at any time.
Well, no, of course. But I think a lot of...
it doesn't have to be, I just want to be clear for everyone, it doesn't have to be severe to go seek a person. You don't have to suffer in silence. But to your point,
Yes.
I just want to be clear about that for everyone.
Yeah, but
listening.
I think, sort of what's the temperature, right? If you have a little bit of light leakage and you can relearn how to pee and, do some strength training and think it's going to resolve or...
I would say this, no amount of leakage is normal.
Today's episode is brought to you by LMNT.
Let's start with the elephant in the room. I don't drink enough water.
You never have.
Recently, I was like, I'm feeling kind of achy. And I was like, maybe I'm not
Yeah,
drinking any
you
water.
literally had one day where you drank enough water and you said, "Hey, Juliet, I had no idea I could feel this good as a human." And I said, "What did you do differently?" And you go, "I drank water today."
And that leads me to why I love lemonade element. I have a hard time just drinking enough water. Right? I'm actually I've started drinking like from a straw cup.
Because that increases your water.
Right,
Yeah, exactly.
It's easier. But when I put lemonade element in it's not a problem.
Yeah, this needs to become everybody's new like summer love affair is lemonade element.
It is bananas. Not only do I drink more, but I actually, wait for it, feel better. This morning, brutal bike intervals. I was pouring sweat. And you know what I thought to myself? I don't need any salt. I'm a 230-pound man.
So did you just have coffee instead?
No, I crushed some element. And it is such a game changer. One of the things that we have forgotten, because we all sort of moved away from sugary beverage, recovery drinks, is that we need to put the electrolytes back in the system. If you are working, we work alongside world elite athletes. They take their salt intake so seriously. And as people have trained really hard and as their diets have gotten kind of like they're cooking whole foods and things, they don't salt anything. And it is a huge opportunity to feel better, go faster, calm, and drink more water.
Well, most importantly, this thing is like the perfect mix of sweet and tart, and also has this nostalgic flavor of the powdered lemonade drinks that were full sugar that we all used to drink in the 70s and 80s out of
no
a
sugar
plastic
This thing is so rad.
container.
I even I just took some hot black tea, right? Just brewed it for a few minutes, dumped a bunch of ice in it, dumped my element in it, boom, salty Palmer. And I'm telling you, they're going to cut me in half. I'm going to be 2/3 lemonade salt. That's the game. Look, right now, if you order through our link, you can get a free sample pack of Element's most popular drink flavors. And if you want to party in your mouth, try sparkling. Go to drinklmnt.com/TRS. And what do we do, Jay?
We drink it every day, literally. This episode of the Ready State podcast is brought to you by Momentous. And today we're going to talk about one of our favorite subjects, which is POG.
More importantly, let's be more scientific. Intrasession POG.
What is POG?
So, passion fruit, orange guava. Everyone knows what that is.
Especially if you're a teenager, it's like hip with that
is.
flavor combo is like very hip with teenagers.
So imagine, let's put POG to the side for a second. We're in the middle of a revolution of carbohydrate fueling exercise, especially high intensity exercise. Our elite cyclists, 100 to 120 grams of carbohydrate an hour. Even in our collegiate athletics, my Uber friends, geniuses, are saying, hey, try to get 60 grams of carbs an hour if you're in a high aerobic sport.
Well, the other thing is, think about youth sports. We have so many kids, including our own kids, who are practicing upwards of 2 hours, 2 to 3 hours, depending on the sport, especially
Getting
by
them
high
some
school.
Very tolerable carbohydrate. We figured out the carbohydrate mix. Momentous has a carbohydrate mix that is gold standard for easy on the digestive system.
Yeah.
And what we're seeing is being able to fuel the session. I think we all, look, if you're going to a 1 hour spin class, it's not what we're talking about. Like, whatever, you can do whatever you want. You will do better if you drink some carbohydrate. But for those intense efforts,
for longer sustained
oh my gosh,
efforts,
what a game difference. And this flavor is so good. Look, I've been on the fuel for a long time. Sometimes I'll come in fasted, right? We're working out first thing in the morning and I won't eat anything. I'll just start drinking right away.
Well,
this is so good.
And bonus, it's carbohydrates plus electrolytes.
Yeah.
So it sort of checks all the intra-session needs
Whatever
that the
nerd,
athlete has.
It tastes so good.
Tastes so good. It's POG.
No cap. It's definitely not mid. There, I did it. Look, if you want to learn more, go to livemomentous.com/TRS and use code TRS and save up to 35% at checkout.
No amount of leakage is normal, and it varies for everyone. So for me, a little leak with tennis is like a huge deal. And I'm like, let's go. I'm spending the next year strength training, pulling in my pelvic floor, building muscle in my body to combat this. For somebody else, they may be like, it's not that big of a deal. So we kind of know it's variable per person to like what their tolerance level is, what their activity levels are. I'm a pretty active person. I'm like, no way, like diapers are not my destiny. Like I'm on this, right? So I think it's a little bit of tolerance, but no amount of leakage is normal. I think that pain, leakage, discomfort, these are this is information from our body that either our mechanics aren't right, something's not functioning well, and whether we choose to take action or not, I think is always up to us. So that's one thing I would say. The other thing is there's absolutely things you can do at home, but I think well, actually, I think one of the beautiful things about healthcare and medicine and fitness is we have options. You can go do in-person training, you can go to in-person therapy, you can do telehealth, you can do digital platforms, or you can read a book. I think a lot of what happens in pelvic floor therapy can feel really mystical and overwhelming. So what I give you in this book is a starting point. And if you do the things in this book and you start the exercises and the training, I think it's a great start. But I say many times, if your symptoms don't get better or they get worse, then I want you to seek in-person help. Because this isn't meant to replace it, it's meant to complement it.
I love that. Let me ask just a blunt question. What is wrong with society that women have children and then we're like, good luck? Because I'll speak to my own experience. Juliet's had a couple of babies. They like literally, here's your baby. Good luck. I hope you just make it home in the baby carrier. I hope you can feed your child. I look around, there are a lot of kids, there are a lot of people. It means that this has happened a lot. Why isn't this part of postpartum care? Why is it that we have to sort of wait till there's a problem before we react? Why isn't just this normal?
That is the way that our medical system works, and it's really unfortunate and ineffective. And it's one of the reasons that I'm so vocal about pelvic floor healthcare is because if we were able to intervene sooner, I think that we would prevent a lot of the issues instead of, to your point, waiting until a problem arises. Or it's like, how bad does the problem need to be, right? Do you need to be soaking your pants in the grocery store aisle? Do you need to be having to change jobs because you can't sit or stand all day? I mean, I think that, and to be super frank, I don't think that we have the infrastructure in this country to appropriately support women, particularly after giving birth. There's no paid medical leave. There's no healthcare coverage. There's no childcare coverage. You get one postpartum visit that's scheduled for 5 minutes to an OBGYN that's completely overwhelmed. And 40% of women don't attend their postpartum check-ins with their medical provider.
And I want to be clear, you don't have to have a baby to have not
Correct.
get any care or anyone else. I just want to be clear, but that ends up being a really obvious
sign.
entry point
Yeah.
for a lot of people. Hey, since we're here and you've just had this child, you pushed a child out through your belly or through your vagina. Now is a chance to talk about all of this musculature
Yeah. I mean,
and connective tissue.
I will say for my part, and I realize you have a pelvic floor your whole life and a different journey with your pelvic floor, but I mean, it at least became a conversation amongst me and my friends after having children, right? Because you have a friend who has a prolapse and you have painful sex and leakage. And so it does start to become a topic of conversation. So just to follow along Kelly's question, what would be an ideal postpartum care situation? I have some ideas, but I would love to hear, what should we be shooting for women in postpartum?
I think there's always like levels of like, I'll take this, but the dream would be this. So in the dream world, I mean, we would treat birth like we would any other surgical procedure in the orthopedic world. When you get a hip replacement, you get therapy day one, right? Then you get home health care, and then you can progress to outpatient
You're
treatment.
blowing my mind right now.
It's the same thing, right? Like you get more care for a knee replacement or an ACL tear than you do for a cesarean section. And yet you don't even have a baby to care for and feed. And so I would say in the dream world, we had acute care therapy and the postpartum, the mom and baby floor, where they teach you literally how do you get out of bed? How do you use the bathroom? Start mobilizing and walking, scar care. I mean, body mechanics, lifting. I mean, the things that we teach people just like we do in any other acute care setting. And then once you return home, you can either do virtual care and or home health. And then at your 6 week, it should be 3 week postpartum visit. Our medical system hasn't caught up to what the recommendation is. But at your 6 week postpartum in-person visit with a gynecologist or midwife, you also see a pelvic floor therapist. And that's what we do at our clinic here in New Orleans. If somebody goes and sees their OBGYN at their 6 week visit, I mean, we see them the next day because I'm like, once you get clearance, like I want to do an intravaginal assessment. I want to look at your cesarean scar perineal tear. I want to look at your diastasis. I mean, before you like go back to exercise and sets, like let's see where you are and what you need to work on before you try to jump back into your normal activity. And then we do ongoing care until they are returned to normal function.
You
I
mean
mean,
the
that's at a minimum.
episiotomy where we cut through your pelvic floor?
Muscles, correct.
Like
Sew them
that
back
we
together
shouldn't
and then
just be
send you home.
casual about that? Oh my gosh.
I mean, and think about these are cut muscles that close the urethra. They close the anal opening. They are the entry point for sex and menstruation. And there's no care. Like if you have a scar, like we mobilize scars, we put silicone in them, but we're not doing that for perineal tears, which is also where scar tissue can form. So there's just it's like this, for lack of better terminology, this black box so that just goes like forgotten. We don't want to talk about it. And then Juliet, to your point, they become these kind of hush hush conversations that we maybe have with girlfriends or their dinner table conversations or private in the bathroom. But then what? Like it should be normal to get care, just like we, you know, get if you said my shoulder hurts, they say, oh, go to physical therapy. I know a really good one. Like this should be no different.
That just makes so much sense to me that it's like actually kind of shocking. um, that's amazing. So the next subject I would love to tackle, which is one of the other ones that's come up a lot in different conversations over the years, is painful sex, and not just what that's about, but what that means for women and what that means for relationships, and what a huge deal it actually can be, not just from the pain perspective, but like from an emotional perspective. So I don't even know where to begin with this painful sex piece,
But
but
this
I
is
think
part
it's
of this
very common.
conversation around
Yeah.
pelvic floor, your genital health.
Yeah, and also just to tack on to that, I'm obviously in the perimenopause, menopause demographic. That's that's what content is served to me. But in addition to having many women I know have pelvic floor problems, which arose after having kids or for whatever reason, and then you add on to that the other things that are happening with perimenopause and menopause, loss of libido, dryness. I mean, you name it, it's like this perfect storm for women. And I think there's probably a lot that we can do, a lot of support women can get. But again, this is a topic that is literally just like discussed quietly at our book club and not really publicly. So I don't even know where my question is.
Discussed quietly.
I think there's like 50 questions in there, but if you could just talk about this subject generally, it's such a big
You
deal.
got it. But it is, I think, and, women are having babies later in life. So more women are having babies in their 40s than in their teens. So you're literally going from postpartum into perimenopause in one blurry season, and you can't even figure out, like, where am I right now? What happens during perimenopause, which is the kind of 5 to 10 years before you hit menopause. Menopause is when you haven't had a period for 12 full months, and you're considered menopausal after that. Perimenopause is this runway before them where your hormones are kind of fluctuating and changing. It feels like, you said, a storm. It's really this hormonal storm where you can't quite figure out what's going on. But I really see perimenopause as this kind of this yellow light that's flashing, like, hey, something's coming. It's like a little danger sign. And you're like, you have an opportunity to kind of prepare for it, or you just head right into the storm with no preparation. If you're in perimenopause, some of the things that you may start noticing are more frequently peeing. It could be like waking at night to pee when you didn't used to, or feeling like you have to pee several times before going to bed. More frequent leaks. So it could be like, oh, I used to be able to run or cough and sneeze and not leak, and now I do. Dryness during intercourse. You may have to feel like you are using lubricant, or there's just dryness or itchiness kind of throughout the month. Heavier menstrual cycles, a feeling of pressure or heaviness in the vagina. Kind of those are some of the more local pelvic floor symptoms. And a lot of that is due to lower estrogen levels. So estrogen starts to decline gradually when we're in perimenopause, and then kind of like just plummets completely after menopause. Estrogen is a hormone that kind of plumps up and lubricates your pelvic floor and your vagina. Your vaginal walls are part of your pelvic floor. So when you have healthy estrogen, you have more lubrication with arousal, you have thicker and more toned pelvic floor muscles and vaginal wall muscles. You can have stronger orgasms because orgasms are actually pelvic floor muscle contractions. So, that's kind of what we see. And when we don't have estrogen, we start having more leaks, more dryness, painful sex, things like that, and also low libido. Estrogen also helps produce collagen, which is a protein in our tissues that offers support. So when we have less collagen, we're more likely to have weakness in the muscles and lack of support, which puts you more susceptible to pelvic organ prolapse. And this is a lot when I hear women, they're in the shower and they're like, I feel like I'm washing, but something's coming out of my vagina. Or I feel like I can't empty my bladder completely or my bowels completely. And it's scary when these things happen. You're like, who wants something coming out of their vagina, right? It feels pretty terrifying, but a lot of it is just due to a lack of support. So I think one thing is educating women on how do you manage this? Exercise, proactively strengthening, using a vaginal moisturizer, which I'm a big fan of. Just like we moisturize our face, use a specific serum or lotion for the vulva and vagina, using a great lubricant during intercourse to decrease pain, and then using topical estrogen, just very locally on the area, or DHEA locally on the area to help plump up and rejuvenate those tissues to minimize the risk of those urinary and sexual symptoms.
And, I am a breast cancer survivor, and I think there is started to be pretty clear research showing that vaginal estrogen is actually fine for women post breast cancer. So I'm just shouting it out to there that I think there's this subset of women who think it's like never an option for them, at least locally. And I think research keeps piling on that it is an option and could be a great option and could solve some of these problems for women. So I'm just throwing that out there.
And I want to circle around again because I want to remind everyone that you're a physical therapist. It means you're a movement specialist. And one of the words that you threw out early on in this conversation was posture. And I think when people think posture, they think, oh, you're slouching in your back, your forehead and neck. But when you and I mean posture, we typically, physios agree that we're talking about the organization of the body. And one of the things that I think helps for when I describe posture for people is like, there are shapes you can get into where you're less effective, where musculature doesn't recruit as well, where you appear weak, but you're what we call in our house positionally inhibited. You're just, things don't work very well. And we were teaching in Australia. What was that? I don't know, 2010 maybe?
It was a long time
Long
ago.
time ago. I was much younger, had hair. And at the end of my course, a woman came up and said, hey, I'm a pelvic floor therapist, and I can't believe how much you talked about organizing the trunk, the pelvis in relationship to the spine, and the function of the hips as it related to the system functioning well. She's like, this was a whole course in pelvic floor health. And I want to remind people that sometimes when we chase better function, it's not just need to play defense here, but by getting ourselves organized, we say, hey, can you stand up and squeeze your butt, for example? And what we see is as soon as you squeeze your butt, you tend to see a pelvis rotate posterior a little bit. And in those positions, your pelvic floor works a little bit more effectively. And when you can rotate your hips and you have hip extension, turns out that, the hip rotators, you have 6 of them, nudged right up against the pelvic floor in a weird way, how they're connected to this region, that we see global changes. We just had in our 102 course, we just had a coach say, hey, I worked on breathing, I worked on sequencing, and then restored some rotation. And this person had much better bladder control. And I just want to make sure that everyone doesn't hear this and say, oh, this isn't me. But that there's a continuum of looking at how the body functions. That isn't just hormonal. There's a lot of things that you can do that are in service of the functionality of the body. Do you think I'm in the right place here? Because
I think
certainly
you're completely right.
This is how I talk about it with men a lot.
Yeah. And I think it's so helpful for you to put it back in the body. Like it feels like, oh, the pelvis, we can just skip over it. But I mean, I'm talking if you have a cesarean scar restriction, which over 30% of women are having C-sections now to give birth, that is going to change your posture in your trunk. That's going to change your shoulder mobility. That's going to change your rib cage mobility and your breathing. Postpartum, you've got a wider rib, intercosta angle. That's going to affect how you engage. If you can't get a neutral pelvis, that's going to inhibit how you can contract your pelvic floor muscles and your TA. I mean, if you've got overactive obturators, that's a pelvic floor muscle that can cause painful sex. I mean, 36 muscles attached to the pelvis. I mean, you can't just look at the levator ani and the obturator and be like, oh, it's just these. I mean, your piriformis does, all of these. And so I think that as crucial as it is for pelvic floor therapists to put the pelvis back in the body and zoom out, I do think that other therapists have to be aware of how to also zoom in because we kind of skip over this part of our body. We maybe look at the hip rotation or knee angles but we're like not really addressing the abdominal wall, the adductors, the glutes. I mean, the hip rotators. It's like to be honest, like, I think that there's this obsession with PTs, like, bring it back to the spine, and I'm like, "It's not the spine." When you have pudendal nerve pain or vulvodynia or it's not your spine, like, you need to kind of get closer to the areas you're afraid of assessing or refer out for those because you're missing a huge portion of the body that, again, like you mentioned, is connected to every breath you take. And I think it's interesting because I gave a lecture recently at our local university, and unfortunately, there was maybe a group of 5 or 6 guys in the background or back left, and they're kinda, like, laughing and not paying attention, and I'm like, "You guys are missing out." Because again, as you mentioned, like 50% of your caseload are gonna be females. You're gonna have female athletes, you're gonna have pregnant women, you're gonna have men who could have pelvic floor dysfunction, breathing problems. I mean, you have to be aware of this, and it's a real disservice if you don't take the time to get comfortable, even just asking the questions and figuring out either who to refer to or get comfortable with doing some of the external stuff yourself because you're missing huge pieces of the puzzle for your clients.
If you let me just say this to all the potential male therapists out there. If you can help a woman have less painful sex, less peeing, less fear, you're a god. I mean, that really like this is one of the things that helps like it's so on top of people's minds because it really does cast a pallor over all of their daily function. And it really is remarkable. I think I've been saying sphincter to belly button for 1,000 years, right? And not always that I need you to brace. I need you to relax sometimes. There's a lot of coaching involved here. But one of the things that I feel is, especially after trauma, and I'll say trauma of birth. I don't mean to categorize it that way, but let's say that you had tearing or an episiotomy or a cesarean. A lot of that proprioception, a lot of that self-awareness is shut down. And I'm fearful of touching. I'm fearful of engaging with these parts of our body. We have been having people roll their bellies on a ball for 100 years, a squishy ball. And we go after the endopelvic fascia. We talk about the abdomen. Is it worthwhile for people to get I've seen something on the internet and I have no affiliation with them called the gooch ball. Have you seen this?
Yeah, I
Right?
do. I had somebody recommend it to me.
And basically it's a soft ball, a squishy ball that allows people to get some pressure into their pelvic floor. You sit on it. It could be done with a towel. That's how we've always taught it. But it seems like sometimes the first step is just, hey, let's see if we can get your brain to reconnect with this part of your body.
Correct.
Is that a reasonable kind of first step for people even?
Yeah, I mean, I think a lot of this, again, we're not taught about this part of our body. We are disconnected from it. And then once trauma happens with whether it be sexual trauma, birth trauma, it could be cancer treatments, anything
Mm.
that there's like almost an avoidance of it. It could be discomfort with intercourse. You kind of distance yourself
Yeah,
from it where
people
you
won't
don't
even
even
touch
want
the
to go near
scars
it.
on their knees, right?
Right, right, and then we're asking people to touch it on their bellies, and there's so much kind of emotion. It's not unusual for us to work on someone's cesarean scar, do massage and, sensitivity work, and their tears are streaming down their face, and it's not because it's painful, but because we're holding so much, like, we've never unpacked these experiences, and so whatever the method is that can help people start to connect, and sometimes having an object or a layer between the hand and the body can be
Mm.
helpful. Even when we have people who can't touch their scars or they're not ready to, I'll have them take a towel and just like wipe over it after a shower or place their hands over their pants and their scars underneath it and just do some diaphragmatic breathing into their hand. I think we need to meet people where they are versus thinking that there's only one way to treat them. And whatever the tools or devices that can help start bridging those gaps, I think that that's really helpful. And we see this a lot with painful sex. It's like, oh, let's relax your pelvic floor and desensitize the muscles. And we have these tools we use called vaginal dilators, and they look like tampons of different sizes. And then you work up to the size that's the same size as your partner or whatever you want to insert into the vagina. But that's a huge challenge to go from using a vaginal dilator to having sexual activity with your partner, right? So we have to kind of give people a pathway to start connecting, to taking those steps. It's like a trail of breadcrumbs to get them to meet their goals. And so I think we have to be creative as therapists at what can we offer them to help get them more comfortable. So I think that those are great ideas. I don't think there's any device that's like a one size fits all going
No.
to solve your problems, but I think it's good to have a toolbox of tools to help you start connecting.
So we've talked about urinary incontinence, painful sex. I think you briefly mentioned prolapse. What are we missing in this common but not normal? Because I think if we do nothing more on this podcast than make sure every woman who listens to it knows that whatever it is they're experiencing might be common but not normal. And then the secondary question is, how do women then talk to their doctors or their healthcare practitioners about these issues, assuming that in many cases, they're going to be told this is normal? How do they have those conversations? So like, what are we missing in the common but not normal so that people know that they're, that they know what's going on? And then how do they have these conversations with their medical people?
So I think the last thing we didn't mention is pooping, which is my all-time favorite topic. That people don't realize that issues with bowel movements are also related to their pelvic floor. So constipation can be due to non-relaxing pelvic floor muscles or uncoordinated pelvic floor muscles that can cause incomplete bowel emptying, straining with bowel movements that can contribute to prolapse, hemorrhoids, fissures, fecal staining. One of the most popular blog posts on my website is skid marks, why you have fecal staining in your underwear. And it's a really common issue, but it can be due to weak anal sphincter muscles, overactive anal sphincter muscles. So if you're having any bowel movement issues or pooping issues, which are actually quite common, your pelvic floor also needs to be assessed because it's likely a contributing factor. And even if it's due to something like colitis or Crohn's or IBS or whatever the diagnosis, your pelvic floor starts to kind of be a piece of the puzzle that needs to be addressed. So I think that that's one thing that I would encourage people. And in the book, I mean, there's a chapter called The Scoop on Poop, and it talks about like how you need to be properly pooping. If you have constipation, it could push on your bladder. A full bowel could push on your bladder and cause more urinary urgency and overactive bladder and leakage. And so just thinking about how all these systems work together, I think is really important. To answer the second part of your question about, I get the question often of, what should I do if I go to my doctor and my doctor says, don't worry about this, or that's normal, or just use more lube, or just relax. And I'd say, well, you should find a different doctor.
I was like, I know the answer to this.
Yeah.
Right. I mean,
Physician.
it's you're being gaslit. And I think there's enough doctors out there where you can find another one, because ultimately, even as a PT, if I don't have the answer for you, I'm going to say, let me find someone who does, right? Like if you come to me and you don't have a pelvic floor issue or you're not benefiting from the care that I'm providing, I'm going to say, okay, let me look into this, talk to my colleagues, find out who the right person to refer you on to next. I don't say like, well, I can't find anything wrong, so just come back in 6 months if it's still there. That's just not the way that we handle patients.
And I want to say
Mhm.
100% yes on finding a different physician, but also I want to remind everyone that your physician may have had 30 minutes of education here. And that I went to physio school, and I'm pretty sure I had some lectures around it. Maybe it was 3 days, maybe it was 4 days. Of course, we talked about the body a lot, but this is not necessarily an area of specialty that is hammered because there's so much to cover. So I just want to, it's a crime of omission, and we are
Yeah.
experiencing the crime of omission, that we're not adequately educating physicians and providers about resources even for, hey, you're going to run into people who have pelvic floors, like 100% of the people you're with, and you need to know what to do next.
Yeah, I mean, I don't even think most people realize that there is a subspecialty of physical therapy that is pelvic floor, right? Like,
Yeah.
so I mean, it's educating people up to that point. Like maybe the person maybe your first call actually isn't to your primary care physician or your OBGYN. Maybe your first call or your first Google search or whatever you're going to do is to try to find a qualified, board certified pelvic floor therapist in your area.
Could we just clip that out and put it on the APTA national site? I mean, yes, 100%.
Yes.
I want to just suggest that if you have a physician that you love, talk to them,
Yeah.
about who they love, right? Because that's actually the physician's office is not the place to address this, believe it or not. Maybe aspects of it, maybe getting a prescription for vaginal estrogen, but you need much more than 6 to 8 minutes to untangle and begin a process of owning your own body.
very
And that you're gonna
complicated.
it's complicated, and you're gonna have to go see a pro. It's easy.
Right, and so that's what I would say is in every state in the United States, you can access or get an evaluation with a pelvic floor physical therapist without a referral from a provider. I'm from a medical provider, so your insurance may require it, but by, Practice Act, you don't have to have a referral. But I would say, like, go to Google, ask your friends, ask your medical provider, do you have someone that you would refer to? Can you ask your partners? A lot of it is, unfortunately, like omission from education that medical providers aren't understanding of the role that therapy can play, but I don't buy that anymore because there's enough chatter out
That's
there
right. That's
that
right.
you need to educate yourself. You need to have a therapist, a pelvic floor PT in your back pocket if you're treating people with vaginas, hands down. So
And
just like I have an OBGYN that I would refer people
that's
to.
right.
So you have to do that, and I just encourage patients, as you all do, like, you have to be the advocate for your body, and that will never change. No matter how great your doctor is, you have to be the driver, not the passenger, and if somebody doesn't refer you or believe in it, don't let that be the end of your story. You will have to continue to push and kind of find the resources, which, again, are much more readily available now than they used to be, but you will have to continue to drive, and I encourage you to keep doing that.
So tell us, I don't know if it's a top 3 or top 5, but are there, and this is for women regardless of whether you're having a pelvic floor issue.
Right. We can always
Just
talk about
yeah,
improving function
yeah,
too.
for are
Building
there like
capacity.
daily non-negotiables or daily habits and practices that you recommend that all women do? I'm sure there would be a whole separate conversation for what men should do, but let's just keep this to women. Like, what are the daily non-negotiables?
And we could add in some
for
things
pelvic
that
floor?
maybe you should avoid or could avoid.
I don't know
Yes,
whether
I
that's
love
3
that.
things, 5 things, but
Let's go.
what
And
should we all be
I
doing?
this is the final chapter of the book, or like the 10 things Sarah does for her pelvic floor. So, I'll give a handful of them. So first, you don't push when you pee. Sit, chill, breathe. Don't push. Second, use a squatty potty underneath your feet when you're pooping. That puts you in a more relaxed position for your pelvic floor, a little stool under your feet, and it's going to help you minimize straining so you don't weaken your pelvic floor. I exhale with exertion. I don't Valsalva when I'm lifting weights, when I'm exerting effort, when I'm pushing furniture. You have to exhale when you're exerting effort to minimize the pressure down on your pelvic floor. I don't push into pain or leakage. If I leak doing something, if I have pain with something, I don't push into it. Like, that might mean pain with sex, that might mean leakage with double enders. It's information from my body that my tissues can't support what I'm asking them to do. And it's not going to get better if I just keep pushing into
Mm.
it. So I think that that's information to take in and make adjustments. I use a great lube. I recommend everyone do it. It doesn't mean that you are not aroused. It means that you have some dryness or some sensitivity, and it can not just decrease friction, but also increase pleasure. So those are kind of my top 5. And then I use being perimenopausal. This is also important for women who are postpartum and breastfeeding, to use a moisturizing balm on the vulva because you have dryness when you have low estrogen, and that happens when you're breastfeeding, but also perimenopausal and menopausal. And then I strength train my pelvic floor, and that doesn't look like me doing Kegels in the carpool lane. That means me pulling in my pelvic floor when I'm lifting weights, when I'm doing squats and lunges, and functioning, like picking up my kid, lifting a stroller, like teaching these muscles to turn on when I need them. And I've just made that part of my daily habit, also my workout routine.
I love it. Well, I think with that, I'm just gonna, for those of you watching on video, congratulations on your book. I think this is your first book, so congratulations.
Thank you.
And I think this is so useful and so valuable. I know people can buy this book wherever they get their books.
That's
And
right.
and where can people find you elsewhere on the internet and on social media, TikTok, you name it? I know you're all over the place. So where can people find more, learn more, and follow your awesome advice and journey?
So I am on Instagram as the Vagina Whisperer. So it's the.vagina.whisperer. And again, as you mentioned, I'll likely be on there in a vulva suit at some point. I'm on TikTok as the Vag Whisperer because TikTok doesn't like the word vagina. And my book Floored, A Woman's Guide to Pelvic Floor Health, at every age and stage is available, and you can find it at all major bookstores. And if you're looking for a pelvic floor therapist, you can Google, you can look on some websites called by the APTA or pelvicrehab.com. But I just really want to let people know that these issues are totally treatable. It's never too late to get care. It's also never too early to start. And I just really hope that Floored helps women better understand their bodies and care for it across the lifespan, because we deserve to be able to, have really great sex and exercise and not leak and do all the things we want to do to have a fulfilling life. And I want that for everyone.
Here.
Here. That is amazing.
Thank you so much. People don't realize that I'm kind of closeted pelvic floor nerd, and I talk about this a lot.
I think we do realize that now. And
I hope you understand that, that this is such a continuum. And if you're with a woman, know a woman, work with young people, this is required reading and understanding about the fundamental and elemental physiology of the human being. Thank you so much for this
Dr.
wonderful
Reardon,
book.
thank you so much for being with us today.
Thanks for having me.